You ever heard of male dairy calves referred to as a byproduct? Perhaps you've wondered yourself about the ethics of breeding cattle to induce lactation that results in a calf with little economic value. If so, you are among the many people concerned about male dairy calf welfare. To give some context, in 2020, in Canada and the United States, approximately 5.2 million male dairy calves were produced by the dairy industry. Most are sold before 2 weeks of age to facilities that rear them for veal or beef, where they often experience high levels of diarrhea and pneumonia. While a lot of research has been done evaluating management practices at veal or beef facilities, less is known about their care on dairy farms. This might be because their time on the dairy is very short, but it is so critical in preventing future health problems, since this is where they will first be exposed to the environment and potential pathogens, and where they will receive colostrum, which is necessary for calves' immune system. Therefore, my research hoped to learn from dairy farmers about their early life care practices for male calves, and what could help motivate them to ensure the male calves that leave their farm get off to a healthy start. To do this, we have so far conducted a focus group study and a survey of dairy farmers. To help share our findings, I've shown the calf in the middle of a teeter-totter, with barriers they face on dairy farms on the left and opportunities on the right. First on the left is the farmer. This represents their priorities, as our focus group participants shared that their high workload meant that sometimes calves, especially males, were second to the milking herd. Next is a dollar sign, which represents the economics of rearing male calves, as 13% of farmers reported this was a limitation to their male calf care. The last limitation is shown by a barn, which represents infrastructure challenges some farms faced, such as a lack of space or difficulty finding and training employees. On the right is, again, a farmer, this time represented by the female gender, as female farmers were more likely to treat male and female calves the same, compared to male farmers who more often fed male calves less colostrum and at a later time point compared to female calves. Next is a picture of the Canadian Code of Practice for Dairy Cattle, as respondents suggested this is a key resource for calf care practices. Last is a stethoscope, as we found that farmers relied heavily on the expertise of their veterinarian for advice and information. Overall, there were subtle differences in how male calves were cared for, due to different challenges farmers might face. Given the importance of veterinarians, our next step is an interview study with vets and farmers, where we hope to learn about how they can engage in informative conversations about male calf care, which we hope can move male calves beyond a byproduct.